Laboratory testing is done at most hospital and physician office visits, but what actually happens to that specimen in the lab? I'm Miriam Holzmeister, Director of Laboratory Services at Salina Regional Health Center.
Miriam, thank you so much for coming on the show. So I thought about having you on to tell us what goes on in the lab. So why don't you tell us about it?
The laboratory testing actually contributes to about 70% of all medical decisions that your physician makes for your health. We run about 55,000 tests per month, which comes out to about 660,000 tests per year. We transfuse a lot of blood, and we have approximately 46 lab employees who are working 24 hours a day around the clock to serve our patients' needs.
So let's talk about some of the changes from the time, when you first started till now.
Basic lab work is done pretty much the same, but back when I started, we were handwriting almost everything in triplicate, manually putting those results on the patient's charts. Now everything is done through computer, and as soon as the results are released in the lab, they're available for the physician and the nurses to see in the computer, and they can act on them immediately. We're continually looking at new developments in laboratory equipment and improving not only the equipment but our other processes in order to reach that efficiency we're looking for. We started using handheld scanners for our blood collections. That has allowed, along with our tube system that goes almost throughout the entire hospital, allowed our lab assistants to collect the blood specimens and send them to the lab without having to make continuous trips back and forth to drop them off.
Okay, let's talk about maybe some future changes to the lab.
Yeah. For the future, we're actually in the process of remodeling right now for a lab automation system, and what that will do is allow us one point of drop-off for all of our specimens so that we put it on the instrument. It accessions it for us, tells the computer system that the specimen's here. It spins it down if it needs to spin it down, and then it will automatically route it to the correct lab analyzer and do the testing all without manual interference.
Miriam, thank you so much for some great information, and thank you for watching. For more information, visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.